My name is Cassandra Karn, and I'm a physician assistant. I've been a PA for 15 years, and all various places in Southern California. I graduated from USC in 2003 in the first master's program. Why did I choose the ER? I chose the ER, I was drawn to the ER. I love the ER. I love meeting people and seeing a ton of people in a day and meeting their families and the fast pace of it and the collaboration and having to talk to a lot of different specialists. But I was exposed to the ER because I was on an ambulance for my hours. I accrued them as an EMT, so I always knew that was my home. My ER is very busy. It's a level 2 trauma center. It's a stroke receiving center. We have a cath lab, so we see high acuity patients, all types of patients, and because of population growth, we're seeing a lot more people as well. So the amount of people we see in a day is more, but we also have a lot more practitioners and nursing staff and specialists, and everything's growing with the patient population. They're the same type of patients. Of course, you see some really interesting cases, but the majority are still the back pains, the chest pains, the abdominal pains, the fevers. But at my hospital in particular, the acuity is much higher. I think that the urgent cares are filtering out more and more of the level 4s and the lower acuity level 5s, and we're seeing the higher acuity, more of our patients get admitted, so that's a big change. People would always say, what's a PA? Or some of the patients would ask to see my attending physician. They felt uncomfortable, they didn't really know what I did, where I was coming from, but I think everybody knows about PAs now. I think it's very rare that people haven't run into a PA or heard about a PA or had a family member that was seen by a PA. So that part is just wonderful. It's great. I think when I got out, I probably made about a third of what I do now. And hiring salaries for PAs are much better. They're different. They came from different areas. Nurse practitioners obviously have a nursing background. Usually they were nurses for quite a while before they went on to get their higher education and their master's degrees to become nurse practitioners. They can prescribe autonomously. I think in our area, a lot of nurse practitioners are still working with a supervising physician. Certainly in my ER they are, but in other areas they're more autonomous. So PAs either come from a military background or a lot of times a science background, and then after accruing hours in the medical field they went to PA school. So just backgrounds. I love figuring stuff out. So I love when somebody comes in and I order labs or a CT and I think about it, and then there's that aha moment. This is due to low sodium or due to even mono, to appendicitis. There's kind of that definitive, I figured it out and now we can help the person and fix it. That would probably be one of my favorite things. And then I love just meeting people and hearing their stories and talking to them and, I don't know, nurturing them a bit. So I love that. And then I love the people that work in the ER. That's actually probably number one. I love the people I meet in the ER and the doctors and the nurses and the techs and even the janitorial staff, everybody. I love them. I would definitely do it again. I did. I worked Locum Tenens, quite a few. Specifically, probably the two best ones are I worked at an urgent care family practice, freestanding in Modesto. And I stayed at a hotel. I believe my assignment was, I think, 3 weeks to a month, and that was a lot of fun. And then I also worked at a women's clinic in Santa Ana, and I loved that as well. And I would definitely do it again. In fact, I kind of plan to do it again. I think that if my husband was retired and maybe my current ER job I had a little more flexibility from, I would definitely take assignments. I think it's just a different world and you get exposed to different types of medicine and different people in different areas, and it was always good. It was awesome. I would say absolutely go for it. It's a wonderful job. I love it. I have a lot of flexibility. I have a lot of freedom. You can switch between areas of medicine, and just the patients, the collaboration, wonderful. And I do speak to a lot of people that are thinking of becoming a PA and have these conversations, and I think everyone who's gone into it has come back to me and said that they're really glad they made the decision. So I just wanted to end this by saying thank you so much to Pacific Companies for interviewing me and letting me share my passion about the PA profession, about my experiences with medicine, with being a physician assistant, and I just think they're a great company and worthy of your time. So thank you so much.